In complicated myofibrosis, myofibrosis is a complex condition that has not been successfully cured, and myofascial syndrome is a disease of the muscles and fascia forming trigger points and indirectly affecting cartilaginous structures and tissues. It can be the neck, it can be the lower back quadratus muscle, it can be the iliopsoas muscle, such as the iliopsoas muscle. This particular sound, known as muscle fibrosis, is characterized by a distinct auditory signature. Normal, healthy muscles do not sound like this, resembling a sound, as if bone is hitting bone. Healthy muscles, in contrast, produce no such sound, and the noise is akin to the sensation of bone striking against bone. Here is the main connection. Observe here the primary connection point. Here is a kind of cervical corset that the brain has formed. This area functions as a sort of cervical corset, a protective mechanism that the brain has ingeniously developed over time. Here. There is something walled up. We can see that, right? Here we see. Here we won't see anything. There is something walled up. The spinous processes, vertebrae, vessels, veins, capillaries of the venous system and vessels of the lymphatic system are sealed. They are fused into this bony cartilaginous formation. Accordingly, the brain's nutrition with oxygen and macro and micronutrients such as glucose and amino acids is reduced. This reduction in nutrition can lead to various cognitive impairments and affect overall brain health. The function of the lymphatic system in removing metabolic waste from the brain decreases, and the lymphatic system plays a crucial role in maintaining the brain's environment by clearing out waste products. Up to 30% of the metabolic waste must be removed from the brain itself, which accounts for up to 30% of a person's potassium and other essential nutrients. The removal of the work products of neurons, blood vessels, and glia is reduced, leading to their accumulation. Yes, nutrition flows through the arteries, particularly through the vertebral artery, which is fundamental. But alongside the vertebral artery runs the vertebral vein. The artery carries oxygen and nutrients. Arterial blood is transported to the brain, and venous blood must be drained back from the brain through the vertebral vein, which lies parallel to the vertebral artery, in order to maintain proper circulation, such as with the waste products of brain cells, with carbon dioxide, and with various other toxic waste substances. But since the muscles adjacent to the vertebral vein are in a way that is similar to concrete, they ultimately compress the vertebral vein, from which the blood processed by the brain should indeed flow away. In the human body, approximately Up to 80% of the work of the circulatory system is done by the small capillary network, such as the tiny vessels. Capillaries, also known as vessels, are located in the muscles and fascia, and they are completely compressed and do not perform their function. Accordingly, when the muscles compress the vertebral vein, let's say, by approximately 10%, the outflow of venous blood from the brain decreases. This may lead to an increase in intracranial pressure. To prevent this from happening, the brain sends a command to the vertebral artery to constrict to the size of the vertebral vein compressed by the muscles. If this is 10%, then the flow of oxygen and nutrients to the brain is reduced by 10%, with minerals and electrolytes being the most important to balance this. The vertebral vein is compressed by muscles by 10%, and the vertebral artery is also compressed by 10%, leading to a diagnosis of vertebral artery syndrome. This diagnosis is incorrect. The issue lies in the muscles, fibrosis, and trigger points. What are the symptoms? Here is the patient. Impaired vision. Yes. Congestion in the ears. Yes. What else? That's all. But all of this is called hypoxia, the oxygen deprivation of brain cells. What other symptoms might there be? Irritability, clouded consciousness, if this continues for a long time. The patient is simply young and is undergoing myopressure. Deterioration of vision, hearing, tinnitus, poor memory function, various cognitive distortions, and so on, such as including, and so forth. Therefore, if a patient were to consult a specialist, such as a manual therapist, chiropractor, from the word chiro, well, not chiro in that sense, this type of specialist, a parasite, would tell him that his vertebra, the atlas, has shifted and needs to be corrected. But the thing is, it is not a vertebra. This is muscle fibrosis. If our patient were to see a neurologist, the neurologist would start giving him injections, prescribe muscle relaxants, and maybe refer him to a psychologist. This won't help. The only way is this.